I'm Jessica Gall. I'm doing this ears, mouth, nose, and throat assessment for comprehensive health assessment.
My name is Darren Himes. I consent to being recorded for this video for this class assignment.
Okay, Darren, so I'm going to start out by assessing your ears. I'm just going to be starting to look at your external structures, okay? All right, so I'm looking at the size and the shape, and they're normal size. They're between 4 and 10 centimeters vertically, and the shape is normal. As far as the skin condition, it's the same color as his facial skin, and I don't see any redness or lesions anywhere. Okay, as far as the position and the alignment on his head, the top of the pinna is in line with his eye on both sides, so that's normal. Okay, so I'm just going to pull a little bit on the pinna. Do you have any pain or tenderness when I do that?
Nope.
Okay, good. If you did, it'd be signs of possible infection somewhere. So I'm going to move now to look at the external auditory canal. So I don't see any redness or lesions here either. I'm also taking note of the size. Same thing. No issues that I'm seeing here. And as far as the cerumen that I'm seeing, or the earwax, it's a little bit, and it's light brown in color, and it's kind of like moist, waxy looking. Okay, and as I said, I was looking at the size of the canal, because if I was going to use the otoscope, which I don't have, I would be looking at the tympanic membrane, making sure that it's kind of a pearl gray color, which is normal, and that it's shiny and translucent. I'd also be looking at the integrity of the tympanic membrane, making sure there's no perforations, and I might also be able to see if he had a lot of ear infections as a child, a white dense patch, which would be scarring on the tympanic membrane. Okay, so now I'm going to do the whispered voice test to test his hearing acuity. Okay, so I'm just going to occlude one ear and whisper words to you, okay? And I want you to repeat them back to me. 3. B.
B.
6.
6.
Okay, and the other side.
4.
K.
K.
2.
2.
Okay, good. All right, so his hearing acuity seems to be normal. I'm going to do the tuning fork tests now. The first one is called the Baber test. So I'm going to be putting this, I'm going to make it vibrate, and I'm going to put it on your forehead, okay?
Mm-hmm.
And I want you to tell me which ear you hear it in, okay?
I hear it in both ears.
Both ears? Okay.
Mm-hmm.
You're supposed to hear it in both ears. That's normal. I was looking for lateralization, like to one side. That could indicate some hearing problems. Now I'm going to do the Rin test, where I'm going to be putting it on behind your ear on the bone, okay, and then next to your ear. I want you to tell me when you stop hearing the noise.
No.
Do you still hear it?
Yes.
Okay, good. That's normal because air conduction, which is here, should be greater than bone conduction. I'm just going to do it on the other side as well. Tell me when.
No.
Do you still hear it?
Yes.
Okay. Alrighty. So finally, to conclude the ear assessment, we're going to do the Romberg test. And this has nothing to do with hearing, but the ear is also involved in maintaining standing balance, okay, equilibrium. So I just want you to stand up with your feet together, okay? And you close your eyes. And we're just gonna stay like this for about 20 seconds, okay? So there's some slight swaying movement, which is totally normal. This is testing his ability to testing the functioning of the vestibular apparatus in the inner ear. And the fact that he's not falling over indicates that the function is good. Okay, very good. All right, so now next I'm going to move on to examining your nose. So I'm just going to look at the external nose here. Okay, so it's just from looking at it, I can tell that it's symmetrical, it's midline, it's in proportion to the rest of your facial features, and I don't see anything, any lesions or signs of inflammation from the outside. So now I'm just going to take my pen light and I'm going to look inside. Okay, if you would tilt your head back, I'm just going to press on the tip of your nose and take a look. Okay, so I'm looking, it's a nice pink color. It looks smooth. I don't see any lesions or ulcerations or anything like that. Okay. All right. And so I'm also just going to test the patency of your nose. So I'm going to, you can bring your head back down, occlude one, and I want you to breathe into the other nostril. Okay, good. Other side. Okay, you see he's able to do that without any issue, which means that there's no obstruction. Okay, so I also took note of the nasal septum when I was looking in his nose, and there's no deviation either way. There's no perforation, there's no bleeding. So it looks nice and healthy in there. Okay, so I'm now just going to press on your sinuses, the maxillary sinuses and your frontal sinuses. I want you to tell me if you have any pain or tenderness.
Nope.
And here?
Nope.
Okay, very good. All right, so now I'm going to move on to examining your mouth. Okay, so I'm just looking at the lips. The color is good. There's no cracking. I don't see any lesions anywhere around. So I'm just going to also look on the inner surface of your lips. Okay, and same thing. It's nice and pink. It's moist. It's smooth. Oops, sorry. Okay. So now I'm going to look at his teeth. So if you'd open up for me. I'm just going to count. All right, so there's 14 on the bottom. And 14 on the top. Normally adults have 32. Did you get any wisdom teeth taken out?
I did.
Okay. And what about, how many did you get taken out?
4.
All 4? Okay. So that would make sense. He has the 28 teeth. Okay. And also just looking at them, they're nice and white. And the gum margin at the teeth is nice and tight. It's well defined. The gums themselves, they look healthy. There's no bleeding with like the pressure that I'm putting on them. They're a good color. I don't see any retraction at the gingival, the line. Okay. So I also just want to ask you to bite down like you're chewing. Okay. And there's no overbite and no underbite. The alignment is normal. Okay. So now I'm going to be looking at your tongue. So I just want you to open up for me. Okay, so it's a good pink color. There's the papillae. on the dorsal surface. You just touch your tongue to the roof of your mouth. Open up a little bigger. Okay, and that one, it's more smooth. I can see the veins, and there's the frenulum. And the U shape, I don't see any ulcerations anywhere. I don't see any lesions or issues or nodules or white patches or anything. Okay, so now I'm just going to look at the inside of your cheeks. At the buccal mucosa, again, it's nice and smooth and pink. I don't see any issues in there. Okay, I'm also going to look at your palate. If you just look up. Okay, so the hard palate, it's white as it's supposed to be. No yellow, so no signs of jaundice anywhere. It's got the rugae on it, and then the soft palate is nice and pink. If you would just say ah for me. Put your head down. Say ah.
Ah.
Okay, and the uvula is midline, it rises up, and that's testing cranial nerve 10, which is the vagus nerve, which seems to be functioning and intact. Okay, so finally I'm just going to look at your tonsils. Okay, and they're oval, they have the indentations or the crypts on them. They're visible, and I don't see any exudate. I'm looking at the pillars, and everything looks nice and healthy. Okay, and I'm going to look at the back, the posterior pharyngeal wall. I just want you to, I'm just going to push down on your tongue a little bit. Okay, and again, the color is nice and pink, smooth, no exudate, no issues there. And we already kind of had to do this, but stick your tongue out for me. Okay, good. It's midline. There's no deviation to either side. There's no tremors or involuntary movement or anything like that. So that's testing cranial nerve 12, which is the hypoglossal nerve. And I also did not note any halitosis or bad breath. So that's your assessment for the day. Okay, thank you.